Physiowebseries Season 1 Shoulder Complex, the Functional Anatomy of Shoulder, Study of the Bone, Scapula, and its Attachments. Scapula has three angles: superior at the level of T2 vertebra, inferior at the level of T7 vertebra, and lateral angle. It has three borders: superior, medial, and lateral. The angles and the borders of the scapula can be appreciated in the diagram. Superior angle, inferior angle, lateral angle, superior border, medial border, lateral border. This is in the posterior view. Similarly, it can be observed in anterior view, and in lateral view we can appreciate supraglenoid tubercle and infraglenoid tubercle very well, along with glenoid cavity and glenoid labrum. Keeping this diagram in the back of the mind, we will now discuss about the attachments of angles and borders of the scapula. Starting with superior angle, its attachments are as follows: upper trapezius and levator scapulae. Inferior angle, its attachments are latissimus dorsi and teres major. Lateral angle, it has attachments at supraglenoid tubercle and infraglenoid tubercle. Long head of biceps brachii at supraglenoid tubercle and long head of triceps brachii at infraglenoid tubercle. Continuing with the three borders of scapula, starting with superior border of scapula, inferior to superior transverse scapular ligament, there is a foramen through which suprascapular nerve passes and supplies supraspinatus and infraspinatus muscles. Medial border attachments: levator scapulae, rhomboid minor, rhomboid major, and serratus anterior. Lateral border attachments: long head of triceps brachii, teres minor, teres major, and subscapularis. Let's study about the spine of scapula. It is present at T3 vertebral level. It has supraspinous and infraspinous fossa. The supraspinous fossa has supraspinatus attached. The infraspinous fossa has infraspinatus attached. Next comes the superior and inferior lip of the spine of scapula. The attachment to superior lip of the spine of scapula is the trapezius, and to the inferior lip of the spine of scapula is deltoid. Next is the spinoglenoid notch. The spinoglenoid notch can be appreciated well in this diagram, through which the suprascapular nerve passes to supply the infraspinatus muscle. Let's study about the acromion process and the coracoid process. Acromion process can be of three types: flat, curved, or hooked. As the shape goes from flat to hooked, there is increased risk of incidence of rotator cuff tears. Have a look at this diagram of acromion process. Type 1 is flat, type 2 is curved, and type 3 is hooked. As this goes from flat to hooked, there is narrowing of the subacromial space, which will cause impingement of the rotator cuff, and also the increased risk of rotator cuff tears in those patients. Coracoid process of the scapula. It has got attachments of muscles and ligaments. Muscles attached are pectoralis minor, coracobrachialis, and short head of biceps. Ligaments associated with coracoid process are trapezoid ligament and conoid ligament.